So at this time, I'm going to walk in the room, introduce myself to the patient. I'm going to perform hand hygiene, and I'm going to ask her how she's doing today. And she will probably tell me she's been having some pain with her bladder. And so I will tell her that we are going to try to alleviate that pain by putting in a straight catheter. And then I'm going to raise the bed up to my height, and I'm going to put a side rail down. And then at this time, I've already performed hand hygiene. I'm going to put on my non-sterile gloves. And, oh wait, this is closed. It just doesn't stay closed, but FYI, that should be closed. And then I'm going to assess how she's doing and just inspect her. I'm going to ask her if she can get into the proper position with like her knees up, so it's easier for me to kind of take a look down there. So I'm just going to tell her that I'm just inspecting her, and it looks like we're all good to go. So at this point, I'm going to take off my non-sterile gloves and dispose of them in the proper area. And I'm going to perform hand hygiene once again. And then at this point, I'm going to, on like a side table or something like that, I'm going to have my catheterization kit, and I'm going to inspect it first and kind of just make sure that we have everything we need to get the procedure started before I kind of get my sterile field ready. And so I'm going to open my catheterization kit first, only touching the 1-inch margin. And I'm going to then get the drape ready, continuing to only touch 1-inch margin. And I'm going to put this under the patient, so I'm going to warn her that I'm going to do that. So, just kind of assist that into the patient. And then I'm going to put the diamond drape on her. Again, only touching that 1-inch margin, making sure that we keep our sterile field. And now, at this time, I believe, wait, do I open? Yeah, so, okay, so I'm gonna do my gloves. And so I'm gonna get that field ready. So again, only the 1-inch margin. Sometimes it can be tricky to open, but just gotta make sure that you only grab that 1-inch margin. So first, you can only touch the inside of the glove. So it's sticking a little bit, unfortunately. Making sure that the outside of the glove is not touching their skin. Then the next time you are able to touch that outside of the glove, what is wrong with these gloves? Okay. And you can assist your hand by maybe. Okay. So now I have my sterile gloves on, and I will further get ready my kit by opening my cleaning swabs. Placing those in the kit, disposing of this in the correct site. And now I will open my lubricant. And at this time, I will go ahead and lube up my catheter. Putting that in the proper disposal site. And now I'm going to get ready to do the catheterization by bringing this over to the bed by her. And now I'm going to touch her and open this up a little bit so it makes it easier to clean. So this hand is now not sterile anymore. So I will clean from cleanest to dirtiest on one side, dispose of that. Clean on the next side, from cleanest to dirtiest, dispose of that. And again, right down the middle, cleanest to dirtiest, dispose of that. And now we are going to get ready, I'm going to dispose of this too, for the catheterization. So, this time, I'm going to get everything ready. So, put this into my cup that I'm going to collect my specimen in. And I will, it can sometimes be tricky because you only have one hand. So, I'm just going to do this as best as I can. At this time, I'm going to ask her to take a deep breath. I'm going to insert the catheter. And then once I see urine come out, I'm going to insert it 1 inch more. And then I'm going to collect this specimen. And then at this time, I'm going to go ahead and I'm going to close up that specimen jar and place that in a different area. And then once the urine stops coming out, I'm going to palpate the bladder to make sure that there is nothing else in there. Then we're good to go. And I'm going to tell her to exhale, and we're going to pull out nice and easy. And then at this time, we are done with the catheterization. So I'm going to take off all the drapes and that kind of thing. And I'm going to take off my gloves, my sterile gloves. And at this time, I'm going to put the correct label on the specimen, and I'm going to perform hand hygiene once again. And I might clean her up a little bit because she has like lubricant and stuff on her and everything, and make sure that she is comfortable. And then once she's comfortable, I'm going to document everything. I'm going to document the tolerance that she had to the procedure, maybe like the color, the odor, the amount of the urine, everything like that. And I'm also going to just leave her with her call light near, and make sure that the bed is back down and that her rails are up and that she is comfortable, and I'll just kind of tell her about what's going to come next in the day.